Okay, so this is risk factors of pregnancy. So we started at 9:38. So let's continue. A patient is diagnosed with an inevitable abortion. Which clinical presentation best describes this condition? So inevitable abortion, it is moderate ang bleeding, moderate ang cramping, open ang cervix, pero no tissue has passed yet. So when we say unsa man ang tissue kay nagpass na. Unsa man tong tissue has passed na, incomplete abortion or complete abortion, which tanan na jud ang naadira. Pero inevitable abortion, no tissue has passed yet. This combination of open cervix, pero open imong cervix and bleeding without expulsion of conception products define inevitable abortion. So, which of the following is not listed as a potential risk factor for a high-risk pregnancy? Wala siya ilabot nga potential risk for high-risk pregnancy. Given birth twice, kay more than 4 times man ta makaingon, multi-parity. So, by parity, dili siya risk factor, dili siya high risk factor kung kaduha pa ka na give birth previously. More than 4 times, dira na kang balaka, guys. According to the nursing diagnosis section, what is the expected outcome for a patient with a potential complication of DIC? So, what is the expected outcome for a patient nga na DIC? Expected ni mga outcome, i-maintain ang normal clotting factor. DIC is a disorder of coagulation. So, the primary goal is to maintain or restore normal clotting factors. So, kailangan nimo i-restore or maintain ang normal clotting factors or levels ani niya, guys. Kay kuan man gud ni siya. Ang clotting factors bitaw kay nanobra tungod sa katong kuan, like naay mga particles dayon mo to na nanaghan na jud ang kuan mga clotting factors. Hemorrhage is a leading cause of maternal morbidity. What is the difference between morbidity and mortality? Morbidity is kanang magkasakit siya, di ba? And mortality is dead na jud. So, hemorrhage kay leading cause of morbidity sa mama. Pero ARI, acute respiratory syndrome, kay leading cause of morbidity to all of the people in the world. And kasakit na ha, dili kamatay. So, what physiological effect is a direct result of the loss of large amount of blood? Unsa the physiological effect direct results to a loss of large amount of blood? Build up of waste products in tissues. Effect is a direct mo ni ang result nganong magka-loss of large amount of blood, dili increase availability of glucose and oxygen na buwang. Nagka-build up of waste products and tissues with nga nagka-result sa inadequate perfusion. Waste products like lactic acid are not efficiently removed from the tissues, leading to their accumulation and then magka-lead to hemorrhage. So, asa kanina siya na kuan na gisulti nga slides. So, which obstetrical history factor is listed as a high risk for a listed as a risk for high-risk pregnancy? Birth of the large gestational baby. Ang high risk na siya kung large for gestational age baby, kay high risk na siya kay there could be a possibility nga katong kuan bitaw katong tawag atong kuan cephalopelvic disproportion muna siya, guys. So, according to the nursing diagnosis section, what is expected outcome for a patient with potential complication of anemia following an abortion? So unsay complication niya kay anemia after abortion. Nurse so may outcome for a patient with potential complication of anemia leading to an abortion. Maintain a hemoglobin of 12 to 14. So, what is the normal hemoglobin gani? Globin is sa female and sa male. So, some 12 to 14 siguro. Ang sa baby, sa mama, ay sa female. Expected outcome for a patient potential complication. So, intervention na pasabot siguro. This specific level measures oxygen carrying capacity of blood and is stated as the goal for managing and preventing anemia. So, which of the following is listed as a specific risk factor with teenage pregnancy? Inadequate prenatal care. So, dili kayo sila ka baloon saon pag prenatal care. So, muna ang risk factor for teenage pregnancies, guys. Especially because there's a stigma. So, dili jud ka makaingon bitaw nga unsaon man nimo like maulaw ba mo ask. So, which medical procedure for abortion involves the use of a progesterone antagonist to prevent implantation? Medical procedure siya, guys, for abortion nga nag-involves the use of progesterone antagonist to prevent implantation. Ano daw? Medical procedure for abortion involves the use of progesterone antagonist to prevent implantation. So, unsa nga procedure for abortion nag-involves og progesterone antagonist to prevent implantation. So, using this progesterone antagonist, ma-prevent na to ang implantation, guys. So, unsa man ni siya nga abortion procedure? Mifepristone. So, prostaglandin antagonist ni siya, which mag-prevent sa implantation. So, leading to abortion. After a complete abortion, when should a patient be advised she can expect her next menstrual flow? So, after ani pwede ta mag-this versus that nga short. Kay akong plan magod sa ning YouTube video. Kay magimo kog shorts about this and that. So, mifepristone and methotrexate, misoprostol. So, may mga difference ana nila. And after a complete abortion, when should a patient be advised she can expect her next menstrual flow? So, kanos aman nga magka next menstrual flow ang patient after complete abortion? 4 to 5 weeks pa, guys. What defines multi-parity? So, how do we differentiate multi-parity with multi-gravidad, no? Multi-parity, so multiple pregnancies. Basta multi-parity, guys, is having given birth to more than 4 times. Parity, we say that as nag-give birth na bitaw gravida kay pregnant lang. So, multi-parity, you have given birth to more than 4 times already. Multi-parity na siya. So, what if you have twins? So, how do we state having twins? What? Following an incomplete abortion, a patient reports shoulder pain. This could be a sign of what complication? Uterine perforation. So, sige siya kamali, ani guys. Kay, iyang ma-answer is, basta na ay shoulder pain kay DIC, which is wrong. Kay uterine perforation is siya. So, when we say perforation, it means nga nabuslot siya. Nabuslot siya, guys. Perforation. The source states that signs of uterine perforation include shoulder and abdominal pain. So, shoulder and abdominal pain. So, next is Ata diri guys ha, usang i-highlight kay kung pila pa ni kabuok. Gamay-gamay na lang. Patient is considered to have a high-risk pregnancy due to multiparity. So, high-risk pregnancy siya due to multiparity. Based on the provided text, what is the specific definition of this risk factor? Having previously given to more than 4 times. So, patient is considered to have high-risk pregnancy due to multiparity. So, high-risk siya due to multiparity. High risk due to multiparity. Based on the provided text, what is the specific definition of this risk factor? Specific definition of this risk factor. Having previously given birth to more than 4 times. So, more than 4 times multiparity. What I meaning? What is the key difference that distinguishes an inevitable abortion from incomplete abortion? The passage of tissues. Which surgical procedure is typically indicated for a pregnancy termination between 12 and 16 weeks? So between 12 and 16 weeks, we use DNV, dilation and vacuum. So when we have below 13 weeks, that's dilation and curettage. And unsa may mga kaning menstrual extraction, unsa may period anemia, 5 to 7 weeks siya guys. 5 to 7 weeks menstrual extraction. Early procedure done. So next question, when managing a patient with RH factor concerns after an abortion, which condition must be bet to administer ROGAM? So kung mag-manage kag patient na RH factor concerns after an abortion, which condition must you administer ROGAM? So we administer ROGAM guys if the mother is negative and iyahang baby is possible positive and iyahang father pod kamates. So sakto ba? So the mother is and the ang COM test must be negative. Kay kung kung positive ang COM test, meaning dili na wala na pulo sa ROGAM kasi sa ROGAMing good is it like a preventative bitaw. So dili kuan ka nang maggamit tag ROGAM para ang maternal kay dili bitaw niya i-fight ang tissues kay abin sa tissues nga ang baby kay kanang something na maka-cause og harm bitaw sa iya ha. So mag-build og antibodies ang mama against sa fetus. So kung negative siya, ma-prevent pa nato na siya. Kung positive na siya, mag-pray na lang tano nga okay ra gyapon ang baby. Basi na aylain pod na tambal. So which nursing intervention is appropriate for a patient experiencing a threatened abortion? So kung naay threatened abortion jud, i-restrict na tong coitus for 2 weeks after bleeding has stopped. Which sign is a characteristic of an inevitable abortion that distinguishes from threatened abortion? Inevitable versus threatened. So close ang cervix sa threatened, while inevitable abortion is open yung cervix. The cervix is open and ruptured sa inevitable abortion. So a patient with 20 weeks of gestation presents with vaginal bleeding and ruptured membrane. Upon assessment, the cervix is dilated, but no tissue has passed. So how should So again, ang no tissue has passed, rad na siya kabuok. Ang first is ang katong threatened and inevitable. So na-dilate na day ang cervix sa inevitable but no tissue has passed. A patient experiencing a incomplete abortion is being monitored post dilatation and curettage. The nurse knows the patient is complaining of sudden sharp shoulder pain. What complication should be immediately suspected if nakay DNC? Again, if nakay, kanilagi ang uterine perforation. So, patient experiencing incomplete abortion being monitored siya for post-DNC. The nurse notes the patient is complaining of sudden sharp shoulder pain. Sudden sharp shoulder pain we can expect if naa siya uterine perforation. Uterine perforation. I think this is almost done, guys. Tatlo na lang. Following a dilation and curettage for an incomplete abortion, the patient reports sharp and same ring a mistake. Sharp shoulder pain, uterine perforation na siya, guys. Which surgical procedure is most appropriate for a patient seeking termination of pregnancy 15 weeks of gestation? Surgical procedure most appropriate for a patient seeking termination of pregnancy at 15 weeks of gestation. Appropriate daw for patient seeking, so again, so ang atong ipili kay D and V. Kay ang D and V manggod 12 to 16 weeks gestation. So kung 15 weeks siya, we have D and V. Okay, last question. A patient is diagnosed with threatened abortion. Which nursing instruction is correct regarding her activity and care at home? So, avoid strenuous activity for 24 hours. Threatened abortion. So, strenuous activity, 24 hours na to siya, i-restrict, and coitus kay 2 weeks. So, let's go over this PPT. So, by our professor, Ma'am Rostine Butalid. So, ang Sustainable Developmental Goal, reduce good health and well-being, reduce child morbidity. So, by 2030, the child morbidity global MMR is less than 70. Maternal mortality rate na siya, guys, mamatay, no? Or less than 70 per 1,000 lives birth. 2030, neonatal and preventable deaths of newborns and children under 5 years old. So, 12 per 1,000 live birth. So, again, ang sa maternal, kay 70 per 100,000, hundreds, kani kay 1,000 lang. And under child morbidity for us, 25 per 1,000 live birth. Ang child na siya kay 25. So, infectious diseases by 2030, end of epidemics and AIDS, TB, malaria, neglected and tropical disease compact. So, mahitabo ba kaya na siya, guys, na ma-end na ang epidemic sa AIDS, sa TB? 2030. So, ensure universal access to sexual and reproductive health care services, including family planning. 20. So, muna tong gikuan. Muna yung grading system. So, I pray, Lord God, nga ang term exam na mo tomorrow would be covered na nato ang 30%. So, dako tag score. So, this is the topic to be will cover. Antenatal, intrapartum. So, what does antenatal mean? Ante, during, current kay ni si ante, oy. So, intra is during labor and delivery. So, paanakay na ka, guys. Post kay after anak, and sexuality is the desire disorders. So, reproductive disorders, pediatric by system, and OP1 unit ra kay Sir Kuan Patsy. So, prenatal care is for high-risk pregnancy, health of mom and baby is compromised. So, as early as possible, risk of pregnancy can be identified. So, unsa purpose of prenatal care? So, these are the 4 purpose. Right? Timely preventative measures can be instituted. Early treatment can be provided. Complications can be prevented. So, preventative measures, mabuhat, complications, ma-prevent. So, risk factors, kay if we have age, so gipa assignment the minimum ano yun sa mga risk factors. So, one of that is age and older than 40. So, chromosomal abnormalities. So, risk factors of teenage pregnancy, we have malnutrition, inadequate prenatal care, abortion, fetal death, and cervical cancer. So, risk factors of pregnancy, we have weight, underweight, or overweight for height. So, malnutrition, guys, dili lang kay siya underweight. It's also overweight for height, gestational diabetes, and macrosomic babies. So, obstetrical history is also a risk factor of pregnancy. We have preterm birth, abortion, stillbirth. So, difference sa abortion and stillbirth is below pa ni siya ang abortion sa age viability, while stillbirth is more than the age of viability. So, more than or equal to. More than, yeah. So, post-term and difficult deliveries. Risk factor of pregnancy, we have family history of genetic disease or previous baby with a birth defect. So we also have risk factors of pregnancy, example kay substance abuse, which causes vasoconstriction leading to decreased blood flow to the placenta. And apil na dere smoking, drinking a lot of coke, caffeine. So possible effects niya guys is can cause low birth weight babies, congenital anomalies, and cognitive and behavioral disorders. So examples sa behavioral disorders is cognitive na ang autism siguro. So, next up is we have pre-existing medical conditions. So, ang mama kay naa siya sakit. So, diabetes, hypertension, cardiac disorders. Infertility medications can also cause damage to the baby. It can cause multiple gestation. So, muna itong gipangita, guys. What is the difference between multiple gestation and multiparity? So, multiple gestation, guys, when we say multiple gestation is daghan o kuan bitaw like twins. So risk factors of pregnancy, external risk factors, we have high temperature, radiation, high altitude. So congenital malformations ang external risk factors niya, which ang radiation guys, we have talked about this sa atong PPT sa katong other risk factors of pregnancy, environmental factors. Ang radiation makakause o congenital malformations. So, high altitudes causes low oxygen concentration. If high temperature pod kay magkalid siya sa perspiration, dehydration, and blood supply. So, risk factors of pregnancy, we have nutritional status, anemia, nutritional deficiencies, and income. So, nutritional status, anemia, and nutritional deficiency. Sa income naman, we have limited resources, multiparity, previously given birth to more than 4 times. So, nga naman mo sin ang endometrium ani guys, which is the lining of the uterus. So, leading causes of maternal mortality, we have top 1, hemorrhage, top 2, infection, top 3, PIH. So, important de kay itong ato ang topic about PIH which we have reported katong severe and mild pre-eclampsia, gestational diabetes, because eclampsia, because this is a maternal factor. So, hemorrhage is the loss of blood for a short amount of period. So, effects niya is ma-decrease ang perfusion, ma-deprive of glucose and oxygen in the tissues, and of course, mag-build up of waste products, mag-circulate to all parts of the body. So we have hypovolemic shock. We have 2 signs of hypovolemic shock, which is 10% of blood volume or approximately 10 units of blood is lost. So, hypovolemic shock, guys, is shock na siya nga. We have to break down what hypovolemic jud means. So, what are the 2 signs of hypovolemic shock? Signs occur when 10% of blood volume or approximately 10 units of blood is lost. So, 1 liter ni ang 1 unit. So, kung 2 okay, so 1 bag DI is equal to 500 ml. So, meaning 1,000 gihapon. 2 units kay meaning 1 liter. Kay 1 bag is equal to 500 ml. So, 2 units kay equals to 1 liter. So, fetal distress will occur when 25 of blood is lost. So, muna ang pathophysiology, process of shock due to blood loss. So, ato pod ni siyang atoan ni siyang gikuan guys, gi-quiz and ato ni siyang gi-assignment. So what is the process of shock due to blood loss? So blood loss kay decrease ang intravascular volume, mo decrease ang venous return, cardiac output, which leads to blood loss. So mo decrease ang intravascular volume sa kanang blood. So mo decrease ang venous return, mo decrease ang cardiac output, and mo lead siya to hypotension. So to compensate, the mother will increase the mother's body will increase the heart rate para somehow makaagi pa ang mga makaadto pa ang blood sa mga essential body parts such as the heart, the brain, kanon siya guys. So manang ma-increase ang heart rate, magkaw siya vasoconstriction of peripheral vessels, kay dili man kay important ang peripheral nga bodies. So iadto niya sa central, no? So increase in respiratory rate and apprehension. So kung ang heart rate and respiratory rate kay murag same siya kuan guys, which leads to cold, clammy skins, especially sa extremities, and decrease ang uterine perfusion sa placenta. Continued blood loss equals BP continues to fall, which reduced renal, uterine, and brain perfusion, leading to lethargy, maternal and fetal death. If decrease ang urine out, so renal failure ta guys. So bleeding disorders in pregnancy. So ang sa ganito, cold, clammy skin, continued blood loss, BP, then decrease, reduced renal, uterine, and brain, leading to coma na dayon to guys. So okay, yeah. Bleeding disorders in pregnancy, we have muna ni siya guys ang rest of the PPT: abortion and ectopic pregnancy sa first trim, hydratipore and PCD in the second try, and third try is the placenta previa and abruptio placenta. So abortion is a termination of pregnancy before 24 weeks of gestation. So muna siya by age, and ang by weight is if before the fetus weighs 500 grams. So what is the normal kg equals 2 grams, 1,000. So half of a kg, and the normal body weight of the baby is, so tuwa jud na siyang i-wall notes na lang, no? Normal body weight of the baby. So abortus is the product of abortion. So man ko magkuan diri kung diri ako med search wall, ako ang MCN wall sa dapit. Ay, diri na lang. Sige, go. So we have types of abortion: elective or therapeutic. So elective or therapeutic. Therapeutic is doctor. Elective is your choice. Spontaneous abortion, missed abortion. Spontaneous is like natural lang siya, nahitabo. Missed abortion is katong wala ka kabalo nga nanaday namatay na bata sa imuhang tiyan. Habitual or namatay na di siya. Habitual abortion, recurrent pregnancy loss. So pray for those people who have struggled to conceive, Lord. And we have septic abortion. Septic abortion is like kanang naay infection, ma-infectionan ka. So we have elective or therapeutic: deliberate termination of a pregnancy, personal choice, health provider. Elective, we have what is the surgical procedures for elective abortion. We have menstrual extraction or suction evacuation. So narrow polyethylene catheter is introduced. Suction niya done at 5 to 7 weeks after last menstrual period. So dilatation and curettage. Secondly, for pregnancy less than 13 weeks, so maigamit ni siya uterine sound to measure the depth of the uterus. Dilation and vacuum between 12 to 16 weeks. So katong giingon niya sa question ganina na 15 weeks, so dilatation na siya. So Cerviprim gel, guys, napod niya siya sa atong other nga kuan unsa perbo sa cerviprime gel is to dilate the cervix. So sa katong poster magod na pregnancy kay dili mo dilate ang cervix, so we use cerviprime gel. So prostaglandin saline induction, 200 ml amniotic fluid is removed. So same ba ni siya sa kuan katong polyhydramnios. So we have saline induction. Remove of amniotic fluid causes cervical dilatation. So dili ni siya guys kaysa pang abortion man nga process, elective abortion. So causes cervical dilatation and uterine cramping. So done at 16 to 24. So 16 to 12 to 16 is DNV, while 16 to 24 is katong prostaglandin and prostaglandin or saline induction. So we have also hysterectomy, which is ang age of gestation niya guys is 16 to 18 weeks. So same siya with CS. Pero hysterotomy, otomy means creating an opening. Hystero, which hyster is, what is this? What organ is this? Comment down below guys. Comment down below. Watch this video and comment down below. So medical procedures, we have mifepristone and methotrexate. So as again, this is a prostaglandin antagonist which causes prevention of the implantation, 600 mg. SD, single dose within 49 days, uterine morbidity and abortion. Drug of choice for cancer, ang methotrexate. Causes trophoblastic cells death. So we also have spontaneous abortion, loss of pregnancy due to natural causes. So trophoblastic cell death, trophoblast is like sa placenta. Okay, so overall categories. 3 overall categories. We have fetal factors that causes abortion. Fetal factors, chromosomal defects. We have maternal factors kay again, dako na yang maternal age, then napo siya autoimmune disease katong ang imuhang kuan bitaw. When we say autoimmune, it's like your own body cells is fighting the normal cells. So like we also have structural abnormalities of the reproductive tract. So infection, which kanang mga STI led to these maternal factors. Endocrine dysfunction like PCOS, coagulation problem, impaired blood flow to the placenta. We also have environmental, poor nutrition, exposure to tobacco, chemicals, or radiation, which again congenital birth defects, uses alcohol, street drugs. So mura po din siya choice manggod sa mama, pero like muni kung daghan po kay alcohol sa imuhang environment or sa street drugs, kay prone ang mama mo kuan ana mo give in. So this is the schematic diagram for spontaneous abortion. So we will go back to this na lang, or if you are watching, screenshot 1 2 3 go. So classification according to the timing of the laws, we have early abortion before 16 weeks. So mag-asta kanos ang early abortion before 16 weeks, kanos ang late abortion between 16 to 24 weeks. Kanos ang early abortion before 16 weeks. Kanos ang late abortion between 16 to 24 weeks. So we also have complications of abortion, hemorrhage, infection, and DIC. So what would abortion lead to? It would lead to hemorrhage, infection, and DIC, guys. Okay, so here we have the disseminated intravascular coagulation mechanism. So, muna siya ang okay, infection, DIC. Complications of abortion, guys. Muna siya different niya sa kwan kay na DIC. Okay, so how is DIC formed? So we have systemic activation of coagulation katong ni daghan na jud ang clotting factors, and magka intravascular deposition of fibrin. So daghan og deposit of fibrin, which leads to thrombosis of small and mid-sized blood vessels. So naay ning clot, naay ning bara, kay nas sobraan og pag-deposit sa fibrin, then leads to organ failure and death. So kani po siya depletion of platelets and coagulation factors. So nahutdan nag platelets guys, dili na maka kuan sa platelets, which leads to bleeding and death. So 4 stages of spontaneous abortion. So we have threatened, inevitable, and complete abortion. So katong spontaneous abortion guys, mo niyang caused by naturals kuan. So diri gikan si threatened, si tick sa spontaneous abortion. So natural causes sa siya, luoy kayong baby o gamay pa kayo. So threatened, possible loss of products of conception. So ma-save pa siya guys. So signs and symptoms, close pa ang cervix pero slightly dilated siya. Vaginal bleeding, naay light vaginal bleeding, none to mild uterine clamping. Symptoms subside or may develop into an inevitable abortion. So muna siya guys, mag-lead siya og inevitable abortion. Ni-open na imuhang cervix ana. So assessment as ang LMP. So kailangan nato i-save all pads to make sure nga makabalot ta sa threatened abortion. So itimbang nato siya, 1 kilogram is equal to 1 liter. So presence of clots, kung nabay clots, no, kay muna siya ang atong i-assess kung possible ka nga na ay threatened abortion. So interventions, so avoid strenuous activity for 24 hours, complete bed rest not indicated, so gradually resume activities, restrict coitus for 2 weeks after bleeding has stopped, no to medication to hold pregnancy. So bawal ka mag-medication, lufaston, so it is estrogen, teratogenic po na siya guys. Inevitable abortion, so muna ni lead to sa threatened abortion. So kung what jud siya naagapan guys, nagka-lead to siya sa inevitable or imminent abortion. So na-loss ang products of conception that cannot be prevented. So moderate or profuse ang bleeding, moderate to severe ang uterine cramping. So katong ganina kay mild to none ra ang uterine cramping, then light ang bleeding. Karon kay so cervix is open and membranes rupture. So how do we manage imminent or inevitable abortion? So what is the priority management? So we have to hospitalize the mother, we have to perform the DNC, and we have to administer oxytocin after DNC para mabalik po siya contract, no? So metherchin tab day ang atong gamit para sa oxytocin ana guys. So first of all kay i-hospitalize jud nato siya. Sympathetic understanding, so we encourage verbalization of kanang feelings. So kung incomplete abortion guys, kay not all products of the is removed, so na retention of other parts of products of conception. So this leads to heavy bleeding. Kay kung dili matarong og go back ang placenta, magkalidjud na siya bleeding guys. So severe uterine clamping, open ang cervix, magka-cause siya passage of tissue. So ultrasound shows some products are still inside. Severe ang uterine clamping dire, dili pareha sa ganina nga mild to profuse lang. So management is first i-DNC nato. So muna siya guys, so muna ang ginagamit na kuan. So muna ba na siyang speculum, so oxytocin infusion, methergine ang katong oxytocin sa kuan. Always man jud ta after DNC mag oxytocin infusion good. So watch for signs for uterine perforation. So we have shoulder pain, abdominal pain, and internal bleeding. So muna siya guys ang atuang timan-an if na uterine perforation. So monitor blood loss, monitor PP, monitor clotting factors, monitor input and output, sympathetic understanding, and emotional support. So complete abortion is the spontaneous expulsion of all products of conception. So tanan-tanan na jud guys ang naa dere. So all products of conception are expelled. No tenderness in the cervix, uterus, or abdomen. So we also have none to mild uterine clamping. Closed ang cervix niya, guys. And empty uterus on ultrasound. So no further medical surgical treatment is done for the mother, but we are going to monitor for continued bleeding or signs of infection. So there what is the sign of infection? If there is fever or discharge. Kaya nga namang fever meaning infection. Comment down below na lang, guys. Kay kuan like mag-fight ang imuhang body against infections. So like magkainit ka na. So like why? Instruct to bed rest for 2 weeks and no intercourse or douching. Tell the patient on intermittent menstrual like flow and cramps for the following week. Next menstrual flow ni mo kay 45 weeks pa. Let the physician evaluate and confirm completeness of abortus. So UTZ and serum HCG exam. Discourage pregnancy for the next 3 months if nag-abortion ka. So, ako kay nag-abortion ako, mama. Pila kaya, no? September man to si ate. So, nag-conceive ako magsulay again February. So, pila na ka months. September, October, November, December. Lapas na kay siya 3 months. So, sakto ang gibuhat sa akong mama. Determine the woman's RH factor. Yeah. So, if the father, so kung na-abortion, guys, dira jud dapat na i-determine na to ang RH factor. Appeal na po dira. So, nag-RH negative ka, tas imong father kay RH positive. I-determine mo siya kung kuan sa com test if naay ang com test manggod if naay antibodies ang mama nga against sa fetus. If wala, so wala pa negative, so mag-give tagrogram within 72 hours. 72 hours if second na dili na maghatag. Kasi pasabot if second dili na. Intrauterine blood transfusion through the umbilical vein. If second, dili no, sa pasabot. So, RH incompatibility. Determine the woman's RH factor if she is RH negative and the father is RH positive or cannot be determined. Have a Combs test. So, determine the woman's RH factor. If she is RH negative, tas ang papa nimo kay RH positive or cannot be determined, so we will have a Combs test. So, if a Combs test is negative, Rogram 500 IU administered within 72 hours. During second pregnancy, dili na ka mag-give of Rogram. Consider other medical measures. So, intrauterine transfusion. So, nganong pagka second pregnancy, dili na ka mag-give og Rogram. Comment down below or i-ask na lang nato na sa yi. Clinical manifestations. So, fetal jaundice, anemia, and hyperbilirubemia. So, surgical management, exchange transfusion, intrauterine transfusion, injecting RBC. What are we talking about naman diri? Saan yung clinical manifestations of clinical manifestations of having not programs. So, like jaundice, hyperlipidemia. So, management na to, intrauterine transfusion. So, dira na to ibutang ang blood transfusion through the placenta. The fetus may receive blood transfusion through the umbilical vein in the placenta. Isn't that cool? But then I meaning sa intrauterine transfusion. Kaya wala pa magkakasabot on sa pasabot sa intrauterine. So, muna siyang management na to, guys, sa second pregnancy. So, unsay reason sa second pregnancy kay dili na mag-give og programs. Ato na i-ask. So, nursing diagnosis, deficient knowledge on fetal conditions, anxiety related to loss of pregnancy and future childbearing, anticipatory grieving related to loss of pregnancy. So, napatay 4 slides left. Missed abortion. So, kung missed abortion, guys, the fetus dies but remains in uterus. So, wala na kay fetal movement, growth, and fetal heart rate. So, diagnostic guys kay i-ultrasound na to siya. So if a dead fetus is at the womb for more than 4 weeks, it can lead to DIC. So management na to guys kay evacuation of products of conception and induction of labor. So habitual abortion more than 3 times na ka guys. More than 3 times na ka mag-abortion. So management is to treat the cause. So specific treatment according to the cause of abortions. We have cervical cerclage. Kung incompetent imong cervix, so cervix cannot held fetus to term. So I feel like muna ang kuan ni tilin sa akong auntie. So fertility drugs as kung dili makakonceive, aspirin or miniheparin for clotting factors, and luteal phase progesterone support, correction of uterine defects, treatment of medical illness. So, infective abortion, kung sa STI, abortion due to infection of maternal, reproductive, or other infections. Dissemination of toxins or bacteria into the maternal secretory and organ system. So, associated with induced abortion by untrained persons using unsterile techniques. So, catheter, Foley bag. So, maka-result na siya septic abortion, no? E. coli ang common nga kwan. So, ang signs of symptoms na to ana niya kay foul smelling, cramping, leukocytosis na siya. Ako nang gi-answer. White blood count. What is the signs and symptoms of having septic abortion? Leukocytoseptic and or endotoxic shock. Hypothermia. So, management treat abortion, high doses of antibiotics, DNC for incomplete. So, nursing diagnosis. Muna siya guys. So, that's all. Bye.